Associate Professor Brett Gordon. I'm an accredited exercise physiologist. I work at the Trobe Rural Health School at Trobe University in Bendigo, Victoria. We are the largest rural health school in Australia, and we teach 14 different disciplines. My educational journey, I did a Bachelor of Human Movement at RMIT. I then went on and did a Master of Exercise Rehabilitation to become an exercise physiologist, and then worked clinically in that field for a number of years before going back to do my PhD. One of the turning points in leading to that PhD was I was working with cardiac rehab almost on a daily basis in my role, and looking at how we can be providing these services better to improve the outcomes. The role I'm in now is Head of Department for Rural Clinical Sciences, so I oversee a number of different health professions and staff within that. And basically we try and collaborate through multidisciplinary teaching and research to enhance the way that we both provide or prepare our future health professionals for the regions, and then the way that they work in those spaces. Cardiovascular disease is the leading cause of morbidity and mortality, and that is true across every region, but it enhances in the regions. And so it's really important that we actually find ways to reduce the experience of that. Some of our data suggests that in regional Victoria, the rate of initial disease and subsequent cardiac disease, so after someone's already had a heart attack, having a secondary heart attack, is rising at a rate that's faster than the metropolitan. We think that's largely because we aren't providing appropriate access to services, and when people get access to those services, we're not optimising the delivery of that care. So we're really keen to work out how we can provide better access and optimise the delivery. The research I'm involved in at the moment is really trying to work out how we can best prescribe exercise for people with chronic conditions, namely cardiovascular disease and diabetes. In the regions, it's really important to overcome some significant barriers around access. People have to travel long distances to see healthcare professionals, and even the specialties of those healthcare professionals are limited. So providing simple ways that we can optimise the way that we prescribe exercise, which has known benefits for almost every health condition, is a really important step that we're trying to get to at the moment. I'm really passionate about regional and rural health because it's been where I grew up. I grew up regionally in Victoria, and it's just so important that we overcome some of the challenges that these individuals face just because of where they live. It shouldn't be the case that if you live in a certain postcode, you are more susceptible to disease and poor health, but yet that's what we currently have here in Australia. And so that's what really drives me to do the work that I do, and hopefully make a difference to our communities, which are so integral out in the regions. It's maybe not a surprise that outside of work I enjoy being active. I'm engaged in a number of different sporting clubs in my local community. I play cricket, or I try and play cricket. I'm involved in junior football and netball, so I really enjoy following my children around and getting involved in their sport as well. And so therefore it's really just about getting involved in the community and socialising. We live in a space that's not too far from metropolitan, so we get the benefit to go down there and do the theatres and do all those types of things. It's not like we're missing out. But it's a really nice thing just to get out and be active and engage with the communities in all the different ways.